Sure. Assalamu alaikum, Zubair. And assalamu alaikum to all the panelists and everyone who's watching. My name is Dr. Sara Said Khurram. I'm the CEO and co-founder of Sehat Kahani. It's a health tech enterprise that connects out-of-work, home-based female doctors to patients who need healthcare using telemedicine. For low-income population, we create nurse-assisted telemedicine clinics. And for masses, we have a mobile application that patients can download and use themselves.
Thank you, Sarah. Haider, if you can tell us about Self and Augment Care.
Hi, everyone. Hello to everyone on the panel as well. I'm Haider Mumtaz. I'm the co-founder of Augment Care. Augment Care is a full-stack healthcare platform. We're focused on digitizing many different legs of healthcare infrastructure in Pakistan. But at the core, we're about digitizing consultations, whether they're happening in clinics, online, through video, physical interaction. We've digitized a number of consultations throughout Pakistan already.
Right, thank you, Heather. Rabia, if you can tell us about yourself and the company you work for, and also how you've been working or assisting the government in the country, because I've heard a few things about that too.
So thanks very much. So hi, everyone. My name is Rabia Khan. I'm a geneticist by training, born and raised Lahore, but currently work at a company called Sensign Health based in the UK. So Sensign Health is a bit of a unique organization. It has a digital health arm where we look at supplying real world remote patient monitoring solutions across the National Health Service in the UK. And I manage the team that looks at using electronic patient record data to accelerate pharmaceutical drug discovery and development. And I've been working closely with some friends of mine from high school, what seems like another lifetime, to think about how we can look at remote patient monitoring for COVID patients. And that's geographic boundary agnostic. So working with some colleagues in NWFP, as well as anyone that's open to listening to what I have to say in Lahore.
Right. Thank you, Rabia. Dr. Zaim, if you can tell us a little bit about yourself.
Assalamu alaikum, everyone. My name is Dr. Zaim, and I'm the District Health Officer in Islamabad. Previously, I've been working as a District Health Officer, Hunza, District Health Officer, and I've always been working as the Director of Health Information Systems, where I have, a health information system. I put health systems, information systems in place in Gilgit-Baltistan and all the 10 districts. So I'm working on COVID right now as a District Health Officer in Islamabad. I've been taking care of all the surveillance and also the primary level healthcare, and also the referrals and management of all the primary and how quarantine patients.
Hamza, if you can tell us about yourself and help for.
Sure. So, Assalamu alaikum, everyone, all to the participants and the panelists. So, I am Hamza Iqbal. I'm the founder of HealthWire. HealthWire is a health tech startup working with the purpose of digitizing clinics and hospitals all over the country. So this is the first problem that we've taken up of digitizing patient health records, and we intend to leverage the solution to get into other revenue streams later on.
Thank you, Hamza. Starting off with you, Haider, if you can tell us briefly about how your business is doing. Have you been working with the government to assist them in their response to COVID, and also if you can touch upon the side of the business which has seen acceleration, because you see that you're trying to digitize, remote healthcare in the entire country. So if you can briefly tell us about that as well.
Yes, I think overall, I think any health tech business right now is quite stretched. We've all been pulled in different directions all at the same time. for us, our core business activities, one were digitizing doctors' clinics. So we went from doing about anywhere between 2,600 to 3,000 odd digital consultations in doctors' clinics per day, down to 600 once the lockdown happened. So we said, okay, what do we do here? How do we arm these doctors with some other type of solution? It took us a while. It took us a good month and a half to figure out how to convince those same doctors who are running these clinic practices to start working online. Even now, adoption is a bit slow. I think we've got some more work to do there. And we're trying to convert a lot of those same consultations onto video now. But the other part of the business where we were already serving up video consultations through a managed team, that went through the roof. That went through the roof. You know, we were doing, in March, we were doing 3x of what we were doing in Feb. In April, we were doing 2x of what we were doing in March. And at some point, it was spiraling out of control because, you know, when growth like that happens, we have staffing issues, we have infrastructure issues, we have tech issues, everything just hit us at the same time. But luckily that one part of the business helped us sustain. You mentioned government, so the Punjab government saw what was happening there and they asked us to white label our app. And to be honest, we had to debate this for some time to try and figure out, did we have the technical bandwidth to really do that? And the ability to support it for free, because at this stage, I mean, the government wanted to do it all for free. So we gave them the mobile app. The University of Health Sciences is using it and is being used by the Punjab governor's hotline, the telemedicine hotline. But beyond that, we didn't do much else with government.
Right. Thank you, Heather. Sarah, if you can quickly tell us about how Sehat Kahani has been doing, especially after COVID.
Right. So I think when Sehat Kahani started and when we started bringing female doctors back to work, our original idea was to create clinics in low-income communities and empower patients in those communities to walk into clinics where doctors are present online through nurse intermediaries and do consultation. That's where the company started from. And it was only last year, October, that we launched our mobile application. And our mobile application works for two kinds of customers. So we have corporate clients who use this for their employees as an alternative to outpatient services. And then we have retail consumers. And both apps are pretty new. And we were just trying very hard to get adaptability to it and adoption to it. When COVID-19 happened, we have 26 clinics across Pakistan, and each one of them had to shut down because in lockdown, private clinics could not work, including our clinics. So we thought that either we can sit on our feet and see this pass through, or we can converge all our energies towards the new app that we have and test if it actually can help people get healthcare in this testing time. So we focused all our energies on the corporate and the retail app. So as Heather said, we also saw an increased adaptability and adoption of the telemedicine application, primarily in our case, because in March, when the COVID-19 issue was rising in Pakistan, we got to partner with Digital Pakistan and the federal government in order to help them help more COVID patients at home. So I think that partnership really helped us leverage our mobile application for people. So we were honestly doing 50 to 70 consultations a month in Feb, and we went to around 500 to 700 consultations in March and growing forward. We had 6 corporates on board. We now have 38 corporates on board and 130,000 lives. So I think what we've seen in the last 2 months is increased adoption to telemedicine. And in our case, the government partnership proved very successful because it gave us the outreach that we needed at that time to reach to a lot of people. And I think following that, a lot of corporate partners came in and extended their support. So Adamji Insurance, Engra Foundation, they all came and extended their support towards the cause and towards helping us help people. So that's been our contribution.
Right, thank you. Rabia, if you can tell us about how your company, first of all, has been dealing with this. What is it that they've been doing? What are some of the trends that you're seeing over there? And, you know, things that we could learn from Pakistan as a country and, you know, our government and maybe the health techs over here could learn from. And also if you can talk about the progress you've made in that remote monitoring system that you're trying to use in response to COVID for COVID patients?
Yeah, absolutely. So the company I work at is quite interesting because similar to what Sarah mentioned is we have a partnership with the UK government. Well, not the UK government per se, but National Health Services, so trusts. And so what we've done is a bit tangential to what some of the people are talking about here, but we've used my teams use different machine learning algorithms to predict patient outcomes. So many people from this panel will have access to a plethora of data, and I'm sure they know the value of that data. And when you start looking at integrating data from electronic patient records, so digitized information, as well as remote patient monitoring, so things you can collect from an app, the fundamental question becomes, can you predict if someone's going to get sick, right? So as a clinician, you'd really like to see someone before they've deteriorated and gone into respiratory failure. You'd like to know that this person is on a downward trajectory versus this one's fine. Can I direct resources to the one that's going on a downward trajectory? And those are the types of things that are now becoming possible with companies like the one on this call, because you've got monitoring at home. You can look at everything that's going on with the person in the house. So Sensign Health has remote monitoring solutions for different things like gestational diabetes, heart failure. We also have something around COVID. But the true power is going to be unlocked. This shift in telemedicine has happened. I don't think we're going to go back to a world where people drop it post-COVID. But now it's about moving to preventative medicine and moving away from just seeing a patient when they're sick, as opposed to understanding they're on a trajectory to get sick. And I see Sarah nodding, so I'm saying something that's reasonable.
Right. Thank you, Rabia. Dr. Zaim, if you can tell us about how the government is using technology to deal with in the response to COVID, and if you can also talk about the government response in general. You representing the government and you being actively involved. How do you see it? Where did we go wrong? What is it that we could have done? Maybe better.
Thank you, Zubir. I think we are working on in multiple layers and on multiple fronts. And when it comes to the primary level of care and with COVID, and then also providing the hospital services to all the patients which we diagnose otherwise who are not COVID or maybe they're COVID. So the government is currently collaborating on with multiple organizations. The Digital Pakistan, if you look at the Digital Pakistan, they're collaborating with some of the owners are sitting right here. And also there are others, for example, the Teledoc and Dr. Tanya Udrus is also like taking a lead in this on the federal side. What I see is when the patients will not come to the hospitals, and also the other people who are not COVID are scared to visit all the hospitals because they have a fear of contracting virus from the hospital. With this, our lady health workers are going door to door, and they have the app which they're using when they're with the patients, and they are consulting with the doctors online. So this is helping us a lot in containing the number of visits that otherwise could happen to the hospitals, and the risk of contracting virus would be less than what it would be otherwise. So the government is still working on if you look at the COVID side, we're still trying to get hold of the increasing numbers of COVID-19 across the country. And rightly so, because there are multiple reasons for that. And since it's a pandemic, and I think I don't expect major lockdowns at this point, but remaining within the domain of what we can do by tracing the context through our own app that we have created, and creating heat maps and making sure that wherever there is a rise in the number of the patients COVID-19 who are home quarantined, we ensure the lockdown in the areas. Digital technology has helped us a lot in making informed decisions to make sure that the spread is, contained, and also the health services are provided to the people who need medical attention.
Right. Thank you, doctor. Hamza, you've been building HealthWire for quite some time, and there is obviously a suite of products that you guys have been working on. I think what you had started as was a doctor booking platform, and then you pivoted your way to become more of a practice software. You're obviously also working closely with the medical institutes and professionals. What are you seeing on the ground? How has demand for your product accelerated? What is your business experiencing these days?
Yeah, so there's been a lot of turbulence on our core business stream that was selling, subscribing doctors, hospitals, and laboratories on our management software. So after the lockdown, most of the health setups got closed. The hospitals had only their emergencies running, which meant that the number of consultations, the number of inpatient visits, the number of lab tests that were booked, everything got decreased to about 20-25%. The whole utility of the software got decreased to 20-25%. But we were slightly lucky because we were already preparing for to enabling our EHR, our systems with telehealth. We had done a pilot in December. We faced a lot of resistance from doctors back then, but we had a basic structure laid down already, which we quickly assembled in 5 to 7 days. And by the end of March, we could start enabling our doctors who were using our EHR to video consult with their patients online. The patients were paying through payment gateways, and the doctors were giving online consultations. So that went well. April went well. That's when most of the doctors weren't able to go to their OPDs. But as the OPDs start to open up, I think there has been a lot of encouragement on the telehealth end. Still, I think it's a lot. There's a lot of resistance on the patient end too, because the experience that the patients are getting, they don't get satisfied. So if they have a doctor who's sitting at a single day of the week, they'll be happy to go for a physical checkup rather than getting the appointment done online. So it has helped. It has helped. If it in normal course of times, it would have taken very long. But so the key, so telehealth is the buzzword, right? So it's not difficult now to convince a doctor, but for a patient, on the funnel of a patient getting an appointment, we see the biggest drop when the patient has to pay digitally. So there are a lot of things that still need to be done for telehealth to really go forward and take things by the stride. But still, it has been good. It has been a saver. Otherwise, things would have been very much on the south end for our business too, and for overall health services too. But it has still, in those 60 odd days, and even now, it's still a good option for those who don't want to go out, and for the doctors who are okay with consulting online.
Right. Thank you, Hamza. Haider, I've seen Augment Care's app, and it's really nice. I saw the subscription option there too. Now, you as a health tech, you've been doing this for a few years. What do you think are some of the biggest challenges of building, a health tech startup in Pakistan? Hamza has explained some of them, talking about, reluctance of patients to pay online, even if, the appointment is online. They would perhaps not be willing to pay online. Now, I've had I've had an experience too, where I had to book an appointment for my father, and the entire experience was broken. It was not a startup that is today on the panel, but it was someone else. But what I had to do was book an appointment through a simple form on their page, and I had to transfer the money to the bank account. And when my father was supposed to speak to the doctor, they shared a mobile number that was given to place a WhatsApp call on. So from my side, as a patient who was willing to pay digitally, I'm not completely satisfied with the experience that I received. But what do you think are some of the biggest challenges when you work as a health tech in Pakistan?
Yeah. No, so first of all, I think I'm still learning in this market. There are definitely people on this panel and others that have been at it longer than I have in Pakistan, and they have a lot more to share. But I would say that my comparison points are always from my experience in the Middle East. I scaled up a doctor discovery platform called Dr. Runa in Egypt, Jordan, UAE, and Kuwait and Saudi. And over there, what I learned was there's always an opportunity to do a bit of smoke and mirrors using health tech, right? Show someone's schedule, pretend that it's real, collect the advance payment, and then afterwards you find out, oh, the doctor doesn't even sit on a Monday at 2 p.m. And so you always have to use tech in a really smart way and legitimate way to deliver value. I think the smoke and mirror tactics, they've died out. Customers expect more. And so I think that's one of the key problems that I've personally faced coming to Pakistan and launching a health tech platform, is that there's been a lot of past disappointment on the provider end from solutions. And there's been a lot of past disappointment from the patient end on solutions. I mean, I personally walked into doctor's office and said, oh, you're like that website. They promised us this too, and they're not going to deliver. They never delivered. You're not going to deliver. Get out. Same concept with the patients. I mean, if you're going to disappoint them like you did, collect payment in advance and not deliver a consultation or make it seem so basic, ya achha, ab to phone call aayegi, that's not true value. And so you have to deliver true value. And I think that's the biggest hurdle. Also, another thing, coming on to everyone's points here, especially Dr. Sarah's and Hamza's, maybe the way to convert a patient is not by targeting the patient directly. Yes, that's always an option, but we're a referral-based society, especially when it comes to making healthcare decisions. So is there a way to maybe latch onto the healthcare provider or that trusted provider and get him to bring in that online patient? I think that's something that we took notice of sometime last year and kind of shifted gear, saying that if we're already embedded in certain healthcare practices, let's use that as the conduit to convert some of those patients online. Apart from that, I think we lost Zubair. I'll just continue. Apart from that, I think one of the other biggest challenges that I've had, moving from a Middle East market to here, is a lot of the core infrastructure that you would expect, especially from a tech basis in healthcare, doesn't exist here. In the Middle East, I was ready to integrate insurance companies and billing networks and work with TPAs to suddenly have authenticated transactions land up here, and none of that exists. So your opportunity to scale up is just so much harder. Who do you plug into? You know, if we were all trying to build health tech platforms in the United States, boom, you plug into a couple of insurance companies and you've got scale. So I think the challenge always here has been, how do you generate that scale when there aren't enough existing infrastructure points to connect into?
I think till Zubair is back, I just want to second what Heather said. And I just want to add one very, very important angle that we usually miss out and that I feel very strongly about. I second everything that Heather is saying, that, we don't have infrastructure or patients who are trying to adopt. But I think a very important thing that I've seen is that there is no clear policy regarding telemedicine in Pakistan. And when you don't have a clear policy, when you don't have a regulation in place, a legislation in place, you are so stranded because hospitals don't accept you. Patients ask you, where is the law? What can you do? Can you give prescriptions? Can you not give prescriptions? Can you use it in emergency and non-emergency? Where is the referral mechanism? Investors don't want to invest in you because they say there's no law and anyone can shut you down tomorrow saying it's not possible. The data protection law that has come out and tabled in IT ministry does not mention telemedicine or telehealth at all. So I think my biggest challenges has been and always will be that at the government level, provincial or federal, there is no official recognition of telemedicine except in emergency cases, which was written, what, 30 years ago in the Code of Ethics of PMDC. I think until that changes, because first thing the NHS did post COVID-19 for telehealth, they gave a list of 9 or 10 providers, and Rabia can second this, that can provide telehealth in the country. And if we had done that also in Pakistan, you would have a much clearer picture of which telemedicine providers are doing the correct job, as opposed to WhatsApp-based services that have emerged in the country to provide healthcare to patients. So that has been one of my biggest challenges in understanding telemedicine in Pakistan.
I think just
Right.
adding to that, sorry, Zubair, just adding to that,
Sure, please go ahead.
I think the other thing that's going to become quite pivotal is most of the world goes to telemedicine. You've seen it in Rwanda, the Middle East, NHS is patient data privacy. And if there's no legislation from a government, it's ripe for exploitation, and you're going to alienate the patients, and you're going to make it very difficult for all these wonderful companies. They can have the world's best product, but if someone's health data is exploited, you can imagine if someone has a condition that they don't want the world to know, if your systems are hackable, that becomes an exploitation mechanism, especially for people that are vulnerable. And so that's something that most governments will have to think about quite quickly as we go to telemedicine.
Right. Thank you, Rabia. Hamza, I have the same question for you. What do you think are some of the biggest challenges that you're facing as a health tech? And then I'll go back to Rabia to touch upon what she just said and extend this to something else. But Hamza, if you can quickly explain the challenges that you've been facing as health.
Yes, I'll add on to, so in the context of the question, I'll add on to something that Dr. Sara said, that not only in telehealth, overall in health tech, there isn't any regulation. Like when you start building an EHR, you don't have any provincial or any federal body who is defining the way a prescription should be made. That is an opportunity as well, because any international EHR could not be used in the local market, but it makes things for a local company a lot difficult, because the process by which a doctor does consultation varies a lot. The type of prescriptions that they make, every single step of the clinic is very, very different, because there isn't any regulation. So that's one of the challenges. And on the business front, I think the biggest challenge that we have faced, and that was something that was very high initially, and recently we have been able to write that, is convincing a doctor to digitize their practice, because a lot of concerns come in. They're not ready to trust a local company with their data. They think FBR might sneak into things and get information about how many consultations that they're doing or how much they're earning. So, and then most of the consultants are above 40s, right? So convincing them to adopt a software and leave out pen and paper is difficult. So, but signing up the first 50 doctors, clinics, hospitals was very difficult. But over the years, over the months, it's easier when you have referrals to give, when you use your early sign-ups to get referrals. They sort of influence the opinion of the other doctors. So that's helped, but I think regulation coupled with slow adoption and this sort of the specific dynamics of the market we are in uh, slow down the growth that we could have had, but still, I think over the past years it's been better.
Right. Thank you, Hamza. I'm sorry I've been having these connectivity issues. I think this is also one of the challenges. Now I'm sitting in Lahore, and this is happening. I cannot imagine what happens, when someone tries to connect to a doctor through internet in, let's say, from a remote area in Pakistan. But also, I think that's also one of the challenges while doing business here in Pakistan. Rabia, you spoke about, how you guys are trying to help both the government and hospitals in the UK. You you've been working closely with everyone involved in the response to COVID. Do you think this acceleration in telehealth is here to stay, or do you think once COVID goes away, this all this interest from both patients, doctors, and even, hospitals and the government is going to fade away?
So I can only speak to the US, the UK markets, unfortunately, not to Asia and so on, but the panel can speak to that. In the UK, and from my conversations in the US, I think it's here to stay. We've seen a lot of venture funding go into telehealth, which is probably good news for everyone on this panel. In the US, like a massive uptick in anything that is to do with remote monitoring and telehealth, primarily because, at least from my vantage point in the UK, if you can talk to your doctor over an app and you don't have to go wait 4 hours in a consultation room for a 10-minute appointment, then everyone's life is better, right? And so but the UK is a public healthcare system. We have free healthcare at point of contact. So it's a much easier transaction to convert to digital, which is something I think most countries aspire to. Rwanda is partnered with Babylon Health, and they are one of the leading companies now looking at revolutionizing telehealth in developing world. So it's not undoable for a country like Pakistan, and I hope that we do it. But I think it's very much here to stay. It's also completely transformed the pharmaceutical industry. Clinical trials are now going remote via telehealth and telemedicine, which is going to shake up the clinical research organization industry. So from my perspective, I think these are trends that are here to stay, both in high income and low income countries.
Right. Thank you, Rabia. Dr. Zaim, you are obviously with the government, you're working with them. Now, we've seen the government use some technology to help patients and hospitals deal with COVID-19. But what is it that the government today can do to prepare for something like this in the future? The word has been saying that this is not going to be the last pandemic to hit us. And obviously, we were not prepared. Nobody was. I'm not only talking about Pakistan. Nobody in the world was prepared to deal with this. But if we don't, if we obviously don't prepare ourselves for the next one, that would be criminal. So what do you think the government could do, especially in terms of using technology to prepare for something like this in the future?
Zubair, the issue right now is the access to the hospital. And I think everybody's aware of the fact that if we do not have telehealth or any other online service, our hospitals will face this every time. So another option that we are using right now is RMS system, where we are looking at the resources in the hospital and the services being provided to the people who are visiting the hospital. Also to check with the equipment that being provided to the hospitals and the utilization of those equipment in the hospital. So digitalization has its own pros, and I think Dr. Sara or Rabia mentioned that there are issues with the laws. I think that they need to be in place, and I'm sure it's the right time, but I think we should start talking about putting laws in place, and by that protecting the provided the data and the confidentiality of the patients are ensured, and also we are tracking patients at this point by tagging, geotagging through apps. For example, we drop a pin, so we know exactly, keeping all the confidentiality and protection of the data. We know what street, how many people, which house, and if I plot it on the website, so we have access to that and how the spread is happening and how we can use that data. Coming back to the point where the importance of telehealth is going, and I personally do not think it will go back, because it has to grow, and this will grow. And unfortunately, in Pakistan, we didn't have much, thanks to all the entrepreneurs and who have created this opportunity that is also addressed. A lot of doctors do not want to work in hospitals and would want to stay home. And now they're using those people to bring them to some use so that they can also make some money and use the resource that the government had put into produce all that, human resource. So this is addressing another major aspect. Yeah, so I think the telemedicine has to grow, and in a much sophisticated and a much advanced manner. And I see some of the organizations which I would, all of them are probably sitting here, and there are some others who are doing a tremendous job. And we are getting a lot of support when it comes to using that technology and providing, and some of them providing us free health services. For example, in last few days, we have provided almost 2,500 consultations. Okay, so we have provided 2,500 consultations to the patients who are home quarantined and who might not be able to come out of the home because we have a tracking system in place. So this is helping us a lot, both tracking and also providing the primary level healthcare. Now the problem comes, a lot of people do not feel, when they do the consultations online, because we're so used to have like a stethoscope, like touching your body, maybe like your chest, or some doctor talking to you and like looking at your nubs, and that's how. So we need to change the trend as well, and I think this has to start from the primary level, and also to the people sitting here, that they should start thinking about mass mobilization, and also to make people realize, now this is the future. Although I know we cannot do surgeries online, but to all the primary and secondary care, I think this is the best option at this point.
Right. Thank you, Dr. Zaim.
Zubair, I just like to add something to that. I think, look, there are definitely two separate lines of opportunities here over the next 12, 18, 24 months. I think one, the public sector has definitely got to adopt telehealth, because they've already got such an interesting referral mechanism that was installed by the British, the basic health unit to the rural health center and onwards up to the district hospitals, that the core problem is those basic health units don't stay active. So is there a way to get them activated with telehealth? And I think that's something the public sector has to address and try and activate and keep active. I think the other opportunity is in the private space. The unique challenge of Pakistan is that it's primarily an out-of-pocket environment. People are paying for healthcare themselves. Just like all the different countries that Rabia mentioned, this isn't common practice over there. Insurance is covering for everything. Over here, insurance covers for maybe 5 to 6% of healthcare spend, if even that. So the challenge will be, can you deliver enough business value to healthcare practitioners over the next 12 months to get them to keep telehealth active? And that's the opportunity.
Right, absolutely. I completely agree with that. I think insurance also helps with a lot of other things, the patient records being one of them, because if you have insurers paying for the insurance, obviously the hospitals have to digitize that. And this is what I'd like to ask Hamza. I was, to be honest, shocked to see that some of the biggest hospitals in Lahore, they don't have digitized their patient records yet. And they ask you to bring your file whenever you visit them. And every time you go to a new doctor, this new doctor will create a new file for you. And as a patient, you cannot keep your own records. You just don't have a digital way to do it. Now, I think what I fail to understand is, if you're a doctor, if you're a hospital, this digitizing patient records is obviously going to help you with diagnostics and a lot of other things. Why in your right mind would you not do this? What do you think the hospitals, the medical institutes here are thinking, and what do you think some of the challenges that you face while trying to convince them to use these systems, digitizing the health records?
I think the problem with the bigger setups is that it's not that they don't want to digitize or they don't see value in this. The bigger problem with the larger hospitals, especially in Lahore, but in other cities in Islamabad, Karachi too, is that they've invested a lot of money already. So they have MIS teams, IT teams that are 15-20% strong. They're paying them, at least I think if we take the top 3-4 hospitals of Lahore, their monthly budget on their MIS IT team would be close to 1-2 million. And similarly, there are many hospitals who have previously tried to, install softwares by partnering with software houses, and their experiences have not been good. So a lot of money has been spent. I think this is not it might look that they're not interested. They are, but they've spent a lot already. And they're at a time where they need to understand that the expenditure they've done is kind of a sunk cost. And they need to probably start from scratch again and partner up with a company one of the models that's been applied by a lot of hospitals is that they give a software house a contract. The software house builds the software for them, and then when it comes to execution or deployment, since they have done most of the payments and since the software house has no incentive in carrying on with the deployment, and also it's not their domain, so they're not into training hospital staff, and that's a lot difficult, and that's where I think the whole proposition of buying a software at a one-time cost fails. And I think then there are a lot of other complications in our system too. So we find hospitals who have doctors on a permanent basis, on an employment sort of contract, do a lot well with HMIS. So we see Shaukat Khanum, we see in Indus Hospital. These hospitals have doctors on board. These doctors don't come for an hour or two and take their shares from the consultations. So I think they have a lot of control over their doctors. They can push things. With private setups, with most of the private hospitals, the doctors come and go. So they're sitting at 3-4 hospitals. They're on a shared basis. The hospital can't push them. If it's a good doctor, he might have his own receptionist even. So the hospital has very little control on outdoor consultations in many cases. So it gets a lot complicated this way too. But I think they have an interest. They see value in it, but they're invested in a lot of wrong models, and now it's difficult for them to digest that.
Zubair,
Right.
if I may add to that, so
Sure.
Sensign Health has got two divisions, right? So we've got remote monitoring, and the other one is extracting data out of electronic patient records in the NHS. And I don't know of a single country that has effectively deployed fully remote, fully digitized healthcare systems. I think the assumption that obviously this makes sense, why would someone not do it, is true. But the people, as Hamza mentioned, that are responsible for doing this are not wedded to the success of that implementation. And so I spent about 80% of my time working with NHS Trust IT infrastructure, and they're not built to deliver value either to the clinicians or to anyone that wants to use electronic patient data for secondary use like my team does. And until, as Hamza mentioned, we don't flip that to say, actually, the entire purpose of the EPR, the digitized EPR, is to make a doctor's life easier, not just digitize it. You won't get engagement from the doctor because most of these initiatives have not had the clinical first view. They've had an IT first view. And so they've failed because when the clinician interfaces with it, Cerner and so on, it's not making their lives easier. So they switch back to writing on a piece of paper. And that's separate to all of the other behavioral problems that exist with doctors in different hospitals.
Right. Thank you, Rabia. Sarah, you have been building Sehat Kahani for a few years, and you started building the product, the company to one of the reasons, as I understand, was to engage the inactive female doctors, female workforce, bring them into the medical ecosystem and help them offer consultations to patients who would otherwise not be able to afford them. Now, you've been doing this for quite some time, but it seems that you've not been able to hit the scale that you were apparently hoping for in these few years. What do you think lacks right now in Pakistan that is stopping you to hit that scale? Is it more from more from the side of consumer acceptance, or does it have more to do with uh, other things?
See, I think when we started, and I think many of us did start around the same time, so around 3 to 5 to 7 year window. I think that is the time when people didn't even understand what telemedicine was. Traditional doctors did not want to accept that this is a way of doing traditional medicine, of doing medicine. Up to now, people have asked me कि जी नब्स पकड़े बगैर इलाज कैसे होता है, जैसे डॉक्टर ज़ैन ने बोला है, तो हो ही नहीं सकता, हम कैसे पता लगाएंगे? So when we started giving this in low-income communities because of the fact that they are so health averse or underserved that they don't have an option to go to a physical doctor. So we thought that if you don't have an option, it would be easier for patients to comply to telemedicine. And we did see success there. We are able to create 26 clinics that see more than 500 patients a month. And we see a lot of patients adapting to that video call doctor, opposed to the assumption that people used to tell us कि low income communities में लोग नहीं इसको देखेंगे, but they do because they don't have another option. Other options are 50 to 60 kilometers away, 5,000 rupees for consultation going and back. Now, when you apply the same to the mass market in Pakistan, even if people want to adopt to the service, which people want to do now, so pre-COVID, obviously there was a lot of inertia for people to come to telemedicine clinics or apps to have consultation done, because the alternative is easy for people in the urban cities who have the ability to pay. The only problem for people, the main problem is for that 60 to 70% people in Pakistan who might not be in urban cities, might not be getting specialists, might need it through other means. So when we see adaptability and adoption of patients, we see that there's a lack of digitization of payments, so patients can't pay. We see that doctors are even now facing difficulty in accepting this as another mean of medicine. So how we succeeded is the force that we have, the female doctor force that is sitting at home, does not have an alternative career. So they do this as a full-time job. They're loyal to it. They love it. They want to come back again and again. But would a gynecologist sitting in Aga Khan Hospital, would she want to do this every day? I don't think so. I don't think my gynecologist would ever come on my telemedicine platform and do it until she was forced to post-COVID era. And the fourth thing is that even in low-income communities, so for mass scale apps, there is a big problem that unless you define it in black and white, what is accepted and what not, you'll always suffer somewhere or the else. We work with corporate partners. The more corporate partners we bring on board, the more questions we have. Okay, what is going to happen if something happens to the patient? What is going to happen if something happens to a corporate employee? The patients ask us what is going to happen if this medicine reacts. And honestly, we don't have answers to those questions because there's nothing written black and white. So if I or anyone else hasn't seen scale in telemedicine in Pakistan, a big part of it is to do with policy, with inertia related to adaptability, and with digitization of payments. Because until all these three figures come together, then you can question that, okay, the doctor quality wasn't good, or the patient wasn't treated right, or the prescription wasn't given in the right manner, or it was too difficult for the patient. But until you are making sure that the legality and the financial aspect is not taken care of, you can't say that it's not a success till yet, because those questions need to be answered with stakeholders outside the health tech ecosystem.
Right. Thank you, Sarah. Haider, you've worked in the Middle East before. You've built doctor booking platforms over there and scaled them. One of the leading doctor booking platforms in the Middle East, Visita, recently signed a partnership with STC, which also happens to be an investor in the platform through one of their funds that they have anchored, STV. Now, the partnership allows STC employees in Saudi to get free remote consultations. Obviously, they did not disclose the financial details of the partnership, how it is going to work or not. But what do you think is the future of this corporate partnerships in telehealth? Employers being able to offer their employees telehealth solutions to be able to consult with doctors, and obviously like you mentioned, we don't have, insurance in Pakistan. This is not happening. The markets in Gulf highly depend on that. Almost every single person who is legally living there is insured in one way or the other. So it's easier to do there. What do you think are the prospects of doing something similar over here, using corporate partnerships to accelerate telehealth? And what do you think could be the challenges? Heather, you're on mute.
Can you hear me now?
Yeah.
Yeah, and I was saying, thanks for reminding me about Visita. I remember them when they were called Dr. Bridge, and we used to compete with them in Egypt back then. They've done really well, and they've scaled up and actually gone into telehealth in a big way now as well. So corporate partnerships was actually a strong part of our thesis when we launched the company, because if the logic was who pays for healthcare, insurance only covers a very small sliver. Who else is paying for healthcare? And we realized that corporates are. And so since day one, we've had a strong focus on corporates. We actually build a lot of additional healthcare tools for corporates. And during this COVID time, we've helped a number of different organizations come up with COVID triaging mechanisms for their own employees. Because as they got concerned that, okay, this person is demonstrating symptoms, what should happen? How should we get that sick note generated? What are the next steps? Can your doctor now create some sort of note that advises them of the next steps? And so we built a lot of that for them. I think there's still some way to go. We had some initial traction with corporates. The debate has always been for these corporates is how much do they really want to spend on an employee's healthcare? And it sounds a bit crude, but the core problem is insurance costs are very, very low in Pakistan. To insure in an employee for the cost of more than open heart surgery for 1 year costs me 6,000 rupees. That's $50. And so they're going to benchmark it against that always and say, "Acha, usme to open heart surgery ho rahi hai, uski aap kya de rahe hain?" So that's always been the challenge. So we've had to create other software and other tools to deliver value there. But I think one thing that we also fixated on last year was creating channel partnerships. So just like the partnership we just described with the telco, channel partnerships are going to be an interesting way to unlock growth. As you see other markets where out-of-pocket spend is high in healthcare, bundling is an easy win. And so we've gone down that path. We've seen some early successes. You'll probably see some more announcements. We had some planned last month, but we put them on pause because of COVID.
Right.
But corporate is going to be a strong strategy for anyone in health tech in Pakistan, because penetration becomes so much more easier through them.
Absolutely. Thank you, Heather. Dr. Zaim, government has been, doing a lot of things to ensure, to control the spread and all. But one complaint that that an average citizen has had with government officials and government at large as well is their communication strategy. They think that there has been a lot of confusion created, from top to even the average government professional working closely on the response. What do you think? Where did we go wrong in this aspect? And was there something that we could have used perhaps, because as I understand, the government was also provided with free YouTube credits and a lot of things from different companies around the world. Were those not used in a constructive way? Where did we go wrong when it comes to communication, when it comes to educating people?
All the tough questions go to Dr. Zaim, man. I feel bad for you.
That's just because I represent the government at this point, probably, or the civil side of it. But that's okay. I think it is generally a confusion across the country. I mean, I'm not just saying it's. There are two different things that I would want to address first. It's a pandemic. It has confused the entire globe, not just Pakistan. Let's be fair. And secondly, there has been conflicting ideas of how to cater for this. There is Chinese model, there is a Canadian model, there is, which one shall we adopt? And I think at the end of the day, it really mattered with how, another thing that I would want to address is that a lot of people in Pakistan do not even believe in COVID. So you can see, I think 70% of people, if they don't believe in COVID, that's a huge problem. Now, talking about the credits, I think social media has been doing amazing work when it comes to communications of the Federal Ministry of Health and in the district health Islamabad itself. And we've been doing a lot of information, awareness campaigns across the country, and the provinces are doing it their own. And I think the things that went wrong, I think the pandemic went wrong, honestly, because how can you just stop something that that is going on everywhere? And I see a lot of countries like celebrating, or we have stopped COVID for now, that we'll see in next few weeks, how do they respond to that? Ultimately, everybody had to go through this. And I think I do agree with the fact that there has been certain issues with the resources and the entire, if you look at the entire health system in US had collapsed, Italy had collapsed, Iran, and I think China as well. So this will happen, and it's I think it's a time where we all should stand together, and we should address all the healthcare issues through the digital platforms, through the government, through whatever the private platforms we have. At the same time, when we are talking about the digitization of the health systems, I think there are two different parts to it. One is the clinical side of it, and the second one is the hospital management, and the third one is the administrative management on the district level and across Pakistan. I'll give you an example that when we were doing district health information systems in Gilgit-Baltistan, we just had spent, I think, 20 million around amount of money to ensure the health systems across GB, and that included, equipment as well as furnitures as well as training of the people. Now, 1 year later, what we saw was huge return in terms of financial recoveries that we received from the health facilities. So we charged 10 rupees per patient, and we give away medicine, test, everything. We made, I think, 300% increase of the revenue, and that goes to the government's kitty. So there has been different projects across. This is even in Sindh, in Punjab, in Balochistan, in Gilgit, in Kashmir, in Islamabad. So we're working on it, and we are doing it through piecemeal, and then it will happen gradually. I think we did really well when it comes to COVID-19 before Eid. And what wrong was Eid. All the people wanted to have, buy clothes and stuff. So there are 7 reasons that we had concluded. Was one of the reasons was Eid, when everybody went to the shops and the markets, and they contracted virus, and they went back homes. And this is backed by the statistics. If you see, go online on the website of the government, Ministry of National Health Services, where you'll find out a trend of the cases per day until 23rd of May, and then suddenly after 27th and 28th of May, there was a huge hike. So I think it's generally our behaviors where a lot of people would not want to stick to the social distancing practices and preventive practices, and that's generally a very dangerous situation that we see right now. And I think we can still do that by practicing all those things at the same time, providing alternative to the hospital care, alternative to the visit of the patients, as in form of providing them telehealth, online consultations until it's an emergency. But emergencies have been working all that time though. Thank you.
Right, right. Thank you, Doctor. I completely agree. To their credit, the government obviously has been doing a lot of things, and we don't know which country, like Dr. Zaim said, is doing it right. We'll obviously figure it out in probably in the next few years. We should not run to conclusions right now. And obviously, there is a lot of misinformation also on social media platforms that is creating, even more problems for the government. Hamza, I'm changing the direction a little, and going to ask you a question about the funding environment for startups in Pakistan. Obviously, this is not strictly related to health tech, but you've been working as a health tech in the country, and one of your investors recently had put up a thread on Twitter, complaining about how they faced issues while transferring a simple payment to you. If this keeps happening, how do you operate, and who do you address this complaint to? Who do you think is at fault?
Yeah, so I think in terms of the funding environment, I think in the last 2 years it's improved a lot. There are a lot of local and international funds that improved a lot. But I think the issue that we had clearly exposes, I think, a lot of actors in the scene, and I think in that case we won't be blaming. So we don't have any issues with any state actors, with the state bank or anyone else. It was actually an issue with the private bank, which was at fault there, and it shows that I think still the so I think for a foreign fund, it's very difficult to operate in. They're facing problems sending money in the country right now, and for them to convince their investors in future, how they're going to get returns would be very difficult, I'm sure, because when it comes to get money out of the country, it's going to be a lot troubling back then. So I think in terms of the regulations, I think State Bank has done decently over the past months, but when it comes to the relationship of State Bank with private banks, there are a lot of dubious things being done over there. But all in all, I think there's a lot of improvement. I think the past 2 years are very positive. Being a health tech startup, it's difficult because internationally, in every economy, we see the health tech, the growth numbers that you could produce in other markets. It's difficult to produce those numbers in health tech. And in Pakistan, I think it gets a lot difficult because I think the market is still starting, it's in the starting phase of adoption. There are a lot of factors that we've already discussed. The panelists have, I think, discussed multiple factors, and all of those factors that they're facing, they actually stop a startup from on riding a very steep growth trajectory, and which means that being in a health tech business, it gets difficult to produce a steep trajectory, which in turn reduces your chances of getting an investment. But I think all in all, the past 2 years have been better, except the hiccup that we had last month.
Right. Thank you, Hamza. Rabia, in Pakistan, most of the health techs that we've seen come to life within the last few years have been around either, they've been doctor booking platforms or telehealth platforms, or what Hamza is building, practice management softwares. But obviously, there's a lot more that is happening in the world. What do you think are some of the opportunities that could potentially be in Pakistan for entrepreneurs who are trying to, who want to build companies in the health tech, technology companies in the healthcare sector, learning from the West?
Yeah, I think there's two. Obviously, I come at it from a significant lens, one of pharmaceutical R&D and machine learning. So the first one I would say is we have some incredible intellect in the country, so NUST, and some great universities. We really should think about building core competency in machine learning, artificial intelligence, computer vision, diagnostics. Singapore has done a great job, and there's no reason that Pakistan can't do it, right? Other than the fact that there needs to be willingness. And so what that would mean is some of the health tech companies on the call today can exploit cutting edge machine learning techniques to really bring a lot of power, which is going to bring in foreign investment. The other area I think that's going to grow quite substantially is the use of data for pharmaceutical R&D. And so Dubai or UAE, Muscat, most of these countries are now looking to partner their electronic patient record data sets for exploitation for pharmaceutical R&D. And then how do you use digital platforms to support clinical trial recruitment? This is another area Pakistan has an opportunity simply by the sheer number of people that we have. And that we don't use. And so if we can somehow open up the country, so open up Pakistan to incoming investment from pharma, they're looking for places to run clinical trials. They bring a lot of money with them. A classical phase 3 clinical trial for heart failure can be a $500 million US. If we get a sliver of that to run the trials in Pakistan using remote patient monitoring and make the data accessible to the pharmaceutical industry, I think it's going to allow for a lot of inward investment to bring the IT systems that no one else is motivated up to date, but the motivation for the hospital systems there will be incoming money, which, you know, works most times as motivation.
Right. Thank you, Rabia. Sarah, we'll be concluding the panel with the final remarks of your concluding remarks, and also if you can also tell us about, you know, what trends do you see coming in the health tech sector in the next few years in Pakistan? And do you see, I'm not going to use the term unicorn, but do you see $100 million company, a health tech company coming out of Pakistan within the next few years?
I do. I'm a pessimistic person, but I want to be optimistic here. I want to tell myself and everyone else on the panel and in the audience that yes, it can. And it will, and it should, because we have the advantage that we have is the advantage of a population. We have a huge population to bank on. Tele-density and internet penetration is increasing. More people like video calling and chatting to each other on text messages than in person. We also have a lot of health issues, which is an opportunity. We also don't have a legislation, which is also an opportunity for us to come in and create one with the government to make sure that we all are in it together. So there are lots of opportunities, and then there's opportunity, then there will be solutions that will cater to this opportunity, and we will see, we will hopefully see a high growth company in this region and in Pakistan. What I see is I want to focus on something that Rabia said initially, which is initially in her comments about making healthcare more personalized. So one way is to see it through Heather's way, is that bringing more doctors into the platform that then convert their patients to online patients. But another way that I see it is making healthcare more personalized for patients. So any app that can predict, or any system that can predict that if I have a diabetic gene inside me, if my mother was diabetic, how soon can I become one? How can I limit it? What are the medicines I should be taking? What is the healthcare lifestyle I should be applying? If we can somehow enter into machine learning, big data, and AI to do that, I think that has a huge, huge potential to connect to diagnostics, to connect to pharmacy, to connect to insurance providers, to connect to pharmaceuticals, to the corporate sector. And I think health and wellness is generally such an undertapped market that if we have solutions that can cater to health and wellness, I think a lot of corporate and big players will also partner and make sure that it grows. So if I had to say that what is the potential, I think the potential lies in machine learning, AI, and digitizing data and using it to better outcome of patient populations. I think that is a trend that I would want to follow in the next years.
Right. Thank you so much, Sarah. Either if you can also share your final remarks, and if you'd like to answer, do you see a $100 million company coming out of Pakistan from the health tech space within the next few years?
Yeah, I think definitely. I think there's just so much opportunity here because there's so much to do, like Dr. Sarah was saying, like Hamza has been saying, like Rabia has been saying, that she's seen in other parts of the world. there's a lot of opportunity here, whether it's direct to patient, whether it's working with corporates, working with pharma companies directly. There's a lot to do, and the main driver is your population base. Because of that, there's just so much work more to be done, and I hope someone on this panel becomes that very soon.
Yeah, sure. Hamza, your final remarks.
Yeah, so I'll address the same question. I too think that I'm very optimistic on this too, that we'll definitely have a unicorn in the coming years. I think the size of the market is big enough for someone to build a company of that size. And I think as Dr. Sara, I think said too, that even in this panel, we have most of the panelists who have been running companies have been in the business for about 3 to 5 years, and I think they have had hard times, and now it's the market is right. They've also settled in. I think even for the new entrants, there's a lot of space. Even they could, perform this feat. So I definitely see that happening in the coming years.
Right. Thank you, Hamza. Rabia, two quick questions. What would be your advice to somebody in Pakistan who's building a health tech company here? And second, what do you think is one thing that the government or us as a country could learn from the West when it comes to COVID response?
Oh my. So building a company in Pakistan, I think the other people on this panel are probably better suited to answer that than me.
But if you could talk about something that you've learned from from working in the United Kingdom, and which could be applied here, anything that you think could be useful.
Yeah, I think, looking back to what the fact that these are low-income countries, Rwanda, Pakistan, Bangladesh, instead of thinking about it as what's broken, I always think about it in terms of, well, you don't have to go through all of the processes that, let's say, the UK did, right? So a lot of Africa has gone to fully digital payments, and they just sidestepped all of the intermediate steps that the UK and the US. So one of the opportunities that exists for a country like Pakistan is if we can increase, penetration with 5G, then you just sidestep all of the banking and all of the infrastructure, and you just go straight to a better way of working. So instead of trying to build hospitals in rural systems, in fact, I would suggest the government just says, actually, no, we're just going to go telehealth, and we're going to make it digital first, because actually we can now. You don't need to do all of the things that all of the other countries did. And I would consider that a massive opportunity. And you're seeing that play out in many aspects in Africa. I think the other area is find something that's a core competency. And our core competency is highly smart people in large numbers. And so build industries that are contingent on people. Access to data. Data is going to be really valuable in whatever industry we look at moving forward. So we have a lot of people. If we can have them using a lot of tools, and we have good regulatory and ethics frameworks from the government, making that data accessible to use to commercial industries internationally will bring in investment. I mean, personally, we're always looking to partner with countries and companies that have access to organized electronic patient record data, have access to remote monitoring apps. And that's a trend that's across the globe. The US is going to, US companies are going to look at creating dominance. So Google owns your data right now. It would be good if Pakistan owned Pakistani's data and it wasn't owned by foreign nationals. I think that's something I'd really like to see.
Right. Thank you so much, Rabia. Dr. Zaim, what is one thing that you would advise people to do in these times? Obviously, you've been asking to observe social distancing and all. Some have and some have not. But apart from this, what would be your advice to people and anyone who's listening?
Okay, so one thing we as in the district like Islamabad, we did in the past few months is extensive contact tracing though, and this was one of the major strengths in this, and also the numbers that you see up there on the portal, you'll see there are a lot of cases in Islamabad, and then we have so many tests, and this is what we've been doing the entire time. This is one part that we can play. Now, the second thing is I ask people to, I pledge their support, and I also advise them to not go out of your homes if you don't have anything to do out there. Just to sit with your friends out there and give like high fives and, there's no corona. That's a major problem. And also the complaint that you didn't ask me the $1 million question.
Which is?
Which is said, if there's $1 million company coming out of Pakistan.
Okay, yeah, okay, yeah, please, okay. Go ahead.
It was wonderful to have this to be here with all the amazing people out there, in the panel, and for people, I think they need to know that these people put a lot of efforts into creating these opportunities, and I think they should trust and believe that Corona exists, and that's what I asked them to do.
Obviously, thank you so much, Dr. Zaim. And by the way, Rabia, during the beginning of the panel, she offered, she has been working with the KPKA government in some capacity, trying to assist, the friends over there. So maybe, you could use this opportunity to perhaps learn how she could or her company could help in a way. And thank you so much, everyone, for joining in. And thanks for all the hard work, all the efforts that you guys have been making for keeping us all, every Pakistani safe. Each one of you obviously is playing their part, and all of us appreciate that. And we look forward to having you host you for another panel, inshallah, after COVID, to talk about the lessons that we could learn from what happened. Thank you so much, everyone, for joining in. Thank you, Sarah. Thank you, Heather. Thank you, Dr. Zain. Thank you, Hamza. And thank you, Rabia. Thanks a lot.
Thank you, everyone. Have a great night. Thank you. Thank you. Thank you, Zaim Saab. Thank you. Thank you.